The microscope pathology case. Pathology is defined as the study of disease. This case shows pathology slides that were prepared by a young pathologist in 1889. This pathologist, Dr. Lloyd, died the following year at age 30 of tuberculosis. He most likely contracted TB while doing an autopsy on a patient who had also died of this cause. At that time, the leading cause of death in the United States was infectious diseases, and tuberculosis topped the list of these lethal infections. This story emphasizes the often perilous environment of a practicing physician in the 1800s, a time with vanishingly few treatments for any infectious disease. This case also shows various microscopes, most of which are antique brass models that are contemporaneous to Dr. Lloyd's slides. The 19th century is sometimes known as the era of microscopes by some medical historians. Microscopic examination of normal and disease organs led to the establishment of cellular pathology as the central pillar of the medical sciences. As we enter the 21st century, pathology has evolved with the times. Microscopic evaluation is still very important in the diagnosis of human diseases, but other tools have been developed, including immunohistochemistry to genomic evaluation. Molecular pathology has become increasingly important since the completion of mapping of the human genome. Elsewhere in this case, one can see a skull with the nasal sinuses and the dental roots beautifully demonstrated. You can also see various specimen bottles preserved with formalin, the most common tissue fixative used in pathology. Please note the bottles of Ascaris lumbricoides, the most common parasitic worm in humans.